Hi, everybody. This is Jill Swartz with Specialty Med Training, and I'm here with Dr. Kathleen Russo. Hi, Dr. Russo.
Hi, good morning, Jill. How are you?
I'm great, thank you. Dr. Russo, we are continuing our education series for Carolina Health Span in North Carolina, and today we're going to be talking about different types of injections. And differently this time than some of our other education pieces, we have some recorded video. So this is kind of interactive and fun and exciting. So I'm looking forward to sharing this with all your patients and consumers alike that really want to know about these. It seems so complicated and it seems so behind the scenes, but really understanding how do you inject some of the products and services that you offer at Carolina Health Span.
So thank you. At Carolina Health Span, we offer so many different treatments, and we try to keep our therapies so that they're convenient for our patients. So always, our patients are always welcome to come into our office for their therapies, their treatments, their injections, and we're always happy to provide those in the office. But when it's not convenient, or people are traveling these days, or it's just not convenient to come to the office, we're happy to tell our patients, teach our patients, educate them on how they can continue their therapies at home in a safe environment. So what I'd like to do today is just demonstrate some of the types of injections that we offer. All of our patients are educated on the injections when they're given their medication. We demonstrate them. We make sure they're comfortable with the process. But it's always good to have something that you can refer to and just kind of look and see, oh, remind me how to do this. So that's why I wanted to offer these videos, just kind of reviewing a primer, if you will, on the different types of injections.
Yes, great. Well, thank you so much. Okay, so we're going to get right started here and start these videos. And I think first what we're going to show is semaglutide injections.
Okay.
So you can take it away. I'm going to start playing.
Okay. So administering subcutaneous injection. So in this particular video, you're going to see Samantha, and she's going to be doing a semaglutide injection. So of course, before you start the process, you want to have good hygiene, washing your hands with soap and water. You want to gather your supplies, including the medication to be injected, a syringe, the appropriate needle for the type of injection that you'll be doing. And subcutaneous is usually insulin syringe, some alcohol swabs, gauze or cotton balls, and then something to safely dispose of the used needle in. So after you've gathered your supplies, you're going to prepare your injection site. Typically, a subcutaneous injection is done in the abdomen. It can also be done on the back of the arm or the thigh. It's a very non-deep injection, if you will. It's using a very short syringe, needle, and into the subcutaneous fat. So you want to clean off the area with the alcohol pad and dry the area. And now you'll be preparing the medication, putting it into the syringe. So draw back on the syringe to how much medication. You can see in this case, she was doing 30 units. She's going to inject that air into the bottle, which actually just allows for easier for the medication to go into the syringe. So you'll see her withdrawing now. She's going to be withdrawing the amount of medication that she wants, and probably a little bit extra just so that she can remove any air. You don't have to be overly concerned about air. We're not doing an intravascular injection. If there's a little bit of air in your syringe, when you inject that into the subcutaneous fat or the muscle, there's no harm going to be done. But you do want to dispel any extra air. Now we're going to prepare for the actual injection. You can see she's got the needle either at a 90 or a 45-degree angle to the tissue. And then you just gently slide the needle into the tissue and you'll inject the medication.
And just for knowledge for everyone watching, this semaglutide is the weight loss medication, correct?
Yes. So some of the medications that we do use subcutaneous injections for are semaglutide, and teriparatide is another GLP-1 medication for weight loss that we do subcutaneous injections. A lot of our patients also use peptides, whether it's BPC or CJC with ipamorelin or sermorelin. NAD is another medication that we provide. And all of those medications are given subcutaneously, and all of them you can follow these steps that you just watched for a subcutaneous injection. So now Sam is cleaning off her injection site with some alcohol, and she's going to discard the needle and syringe. We typically recommend that you don't try to recap the needle to prevent possibly sticking yourself. And as you can see, it's a very easy injection. Generally, it's not painful at all. It's such a small needle. You can experience some local redness. Some medications will cause a little bit of swelling, redness, and even a little itchiness around the site of the injection. When we dispense your medication, we will always advise you of what type of side effects that you might experience and what to watch for and what to call for. So,
yeah, but safe to say that's a pretty small syringe and very small dosing. So that's very rare.
Yeah, it's a very non-invasive injection, very easy to do, very painless, and almost anyone can do the injection at home.
Okay, great. Well, that was awesome. So yeah, I think it's so important even just to see that, whatever, it's interesting. I didn't even know, and I've been in this space, that you pull back the syringe site and fill it with the amount of air in the dosing site. It's just making it easier to pull. So that's a great little pearl.
Sure, it just allows medicine to come out of the vial a little easier. And with some medications, particularly medicines that are more viscous or have more of an oil consistency, they're harder to get out of the vial. So you'll find that helps with that process.
Great. And so will you just tell everyone, not just semaglutide and as you said, peptides and all the different things, just how they can get in touch with you?
Yep, that's great. So that's the demonstration of a sub-Q injection. And again, some of those medications include peptides, the growth hormone secretagogues, NAD, the weight loss medications like semaglutide and teriparatide. Those are all given subcutaneously.
Excellent. Okay. So now we're going to move on to a testosterone injection, if you will.
Yes. So testosterone is a thick oil, and so it requires an intramuscular injection. And here we have Shane, and he's going to be self-administering a testosterone injection. Again, you want to follow sterile, good hygiene protocol and wash your hands and dry them carefully. And then you'll be gathering your supplies. So we're going to start with our medication, our vial of testosterone. We're going to have our appropriate size syringe with the needle for injection, a needle for pulling the medication out of the vial, an alcohol swab, and then either some gauze or cotton ball. And then we also have here a container for safe disposal of the needle and syringe. So now Shane is going to be preparing his injection site. Again, he'll be using some alcohol. Typically, an intramuscular injection, as the name implies, goes into a muscle, a deep muscle. And so you can use the gluteal muscle, the back of the hip. You can use the thigh muscle. You can also use the deltoid, but in the case of testosterone, it's a thick oil, and so we don't really recommend the arm or the deltoid. We prefer the gluteal muscle or the thigh muscle. So Shane now has put the larger gauge needle onto the syringe. That's an 18 gauge, that pink needle. And it just has a bigger hole, a bigger bore with which to pull the medication out of the vial. As I stated, testosterone is a thick oil, so it is very difficult to get it out of the syringe, out of the vial, if you use a small needle. So you can see he's pulling about 3/4 of an ml out of his vial. And he's tapping out any excess air. And this is a intramuscular injection. It is not a vascular injection. So if there's a little bit of air in there, there's nothing to worry about. You are not going to hurt yourself. This injection will be going into the muscle. If there's a little bubble, it is not going to hurt you. Now he is replacing that bigger needle with a smaller needle. This one happens to be 23 gauge. And that he'll be using that for the actual injection process into his muscle. It just will hurt less with a smaller needle. And so now he's ready to inject, and you can see he is going to pinch the tissue between his thumb and forefinger, put the needle in at a 90-degree angle, and he is going to push the medication in. And this again can be a painless procedure. Sometimes it might pinch a little bit, but it generally is a very easy injection. We are always happy to do the injections in our office, but many of our men find that it's more convenient for them to do it at home. Often, our patients will maybe allow their spouse or a relative to give them their injection after they've had proper training, just to make the process easier also. But we are always happy to teach our patients how to do these injections, so that you can do them safely and effectively at home or come to the office, whatever your preference is. And you'll see Shane is now, although he is capping that needle often, if you have an appropriate disposal unit, you don't need to cap the needle so that you don't take any chance of sticking yourself. Some other injections that we do with medications we use intramuscular injections for are Ultraline, B complex, vitamin D3 injections, glutathione. Those are just a few that may also be given intramuscularly.
And are those, just for discussion's sake, are those also medications that you could actually send home with the patient, or is there some that are not and some that they would have to come in?
Some we do send home and some we don't.
Okay.
So, yeah.
We don't have to go too into that, but just so that
Yeah.
they're familiar.
And
Okay.
we will, when we train our patients and demonstrate the process, we'll talk to you about what signs to look for that are to be concerning and what not to be concerned about. So again, some local redness, some irritation, even a little drop of blood at the injection site is nothing to worry about.
Okay, great. And again, you can learn more about all of these things at carolinahealthspan.com. And then I think the last one we're going to talk about, and this too is a subcutaneous, right? The Ultraline, but just to show another product that again you offer. And
Okay, so this is Amanda, and she's actually going to be demonstrating an intramuscular injection with Ultraline. Ultraline is our energy and fat slimming complex. So it has B vitamins in it. It's got some amino acids, methionine, inositol, choline, which are all helpful for fat burning efficiency. And we use these injections both in the office. We also will dispense them for patients to take home and take the injection at home. It is a red medication. That's the B vitamins that look red. And again, you want to start the process with good hygiene, washing your hands with soap and warm water and drying thoroughly. And then you'll start to prepare your injection.
And is Ultraline something that they take once a week?
Generally, we recommend it once a week. Occasionally, we may say once a month or once every 2 weeks, once every 10 days. So that's something that you and your provider will discuss based on your goals, your health history, and perhaps some lab work. So Amanda here is gathering some Ultraline. You can see she has the vial of the B complex there. She has her syringe with a needle for injection, an alcohol pad, and some gauze as well. So she also has a dispenser for proper disposal of the needle and syringe. So she's going to prepare her injection site. Again, this is intramuscular, so it could be the thigh, it could be the hip, or it could be the deltoid, the arm area. And she's actually going to be using her arm here for the Ultraline injection. This medication is a very thin, kind of like a water consistency. It doesn't have any viscosity to it. And so it is fine to use the upper arm for a Ultraline injection. So she's going to prepare her syringe now. She's going to pull some air into the syringe. It's typically a 1 ml injection. So you can see she's pulling some air into the syringe to the 1 mark. And she's going to inject that air into the vial just for easy removal of the medication. And you can see that little flash of red at the needle. That's the medication. In this case, it's red. That's why it looks that way. And She will fill the vial to just beyond the 1, and then she'll inject some of the medication back into the vial to get exactly 1 ml, and that way she'll be discarding some air that may have accumulated. This is an intramuscular injection. It is not vascular. And so if there is a little bit of air in your syringe, nothing to worry about. You are not going to hurt yourself if there's a little tiny bubble in there. But you do attempt to remove whatever air you can. So now Amanda is ready to inject her Ultraline medication. She's already prepared her site, and she's going to put the needle at a 90-degree angle to the deltoid muscle, and she's going to inject the medicine into the muscle. And you can see she looks very comfortable with the process. And then she'll take the needle out and put some gauze or cotton ball on the site to absorb any fluid or blood that might seep out, and discard of the needle and syringe appropriately. And you can see she did very well. You can put a Band-Aid if you like. Again, we will talk to our patients about what side effects to look for and to watch for, what's concerning and what's not concerning. And we are always happy to do your injections in the office, but if for convenience you prefer to do them at home, we're happy to demonstrate them, teach them, teach a spouse, do whatever we can to make the process as easy as possible for you.
Awesome. These were great. I really enjoyed watching these because it kind of get the, like I said, the sneak peek into how to do it. So that's wonderful. So will you tell everyone how they can get in touch with you, Dr. Russo?
Sure. Carolina Health Span Institute. We have 2 locations. We have one in South Charlotte at 423 South Sharon Amity Road. And then we have one in the Lake Norman area in Huntersville. We have one phone number, 704-333-4817, that will get you to both offices, and we're happy to see you at either office. Thank you very much, Jill. It was nice meeting with you today.
Yes, I agree. Have a wonderful rest of the day, and thank you.
Okay, thank you.
Bye-bye.
Bye-bye.